So a subarachnoid hemorrhage is a type of bleed in the brain that is usually related with a ruptured brain aneurysm. And a brain aneurysm is essentially a bulge on the side of a blood vessel. So if you think about your tire, when you get that welt on the side of the tire, your mechanic is going to tell you you really need to replace that tire. There's no way to fix it. So as that bulge develops and grows, there's a risk that it can rupture and bleed. These are usually located in the major vessels of the brain, right near the base of the brain. Subarachnoid hemorrhage is unfortunately a very devastating disease. Up to a third of patients unfortunately never even make it to the hospital. And of the 2/3 that do make it, up to a third are not able to leave the hospital. The first step in the treatment of subarachnoid hemorrhage is to shut down that aneurysm and prevent a rebleed, which is usually fatal. And we do that very efficiently here at OSF by going in through the leg and coming up inside the body and going into the aneurysm itself and shutting it down from the inside. But as important as the initial treatment is the post-op care, which really will make the difference between a person surviving and doing well versus a person unfortunately not doing well. And that has to happen in a dedicated neuro ICU. And what I mean by neuro ICU is an ICU that is staffed by nurses that have been trained in the neurocritical care emergencies, as well as physicians that have had fellowship training in neurocritical care. There are independent studies that show that people's outcomes are better at institutions that have those facilities in place. And as far as I know, we are the only institution in Rockford that has a dedicated neuro ICU with fellowship trained neurocritical care physicians. That's why I would recommend anyone with a subarachnoid hemorrhage to come to OSF for that reason.